Now it's time to switch gears, and we were going to talk about inspiration, we were going to talk about connection, but now it's time to talk about creation. We also create our own storylines. And today I want to tell you about 3 storylines. I already told you about one, Planet Virus, but I really want to emphasize the next storyline. It's a patient education trajectory where we really explain patients a certain type of surgery. But there's a much better person, an expert here in the room, on stage in Health House, that can explain us way better about the surgery, about the pathology, and that is Dr. Boogers. Alexandra, very welcome on stage. Could you please introduce yourself?
So I'm Alexandra Boogers. I'm a resident in neurology at UZ Leuven, and I'm doing a PhD on DBS in movement disorders, when DBS is actually Deep Brain Stimulation.
So, I told you that this storyline, DBS, is all about patient education. So what exactly do you see when you come here to Health House to visit that storyline?
So we take patients, let's say every 2 months here, and there are usually 6-7 patients with their family members, their caregivers, and then we take them around for about an hour and a half, and we explaining everything about the surgery. Who is eligible, what the advantages are, but also what the disadvantages are, what the risks may be. And we show them different testimonials, but we also let them hold the material. So they can get a real grip of what the surgery is, but also the material.
And what do you mean with the material? What are they then really gripping onto?
So the electrodes that we implant in the brain, then you have the connection wire and the battery, or the neurostimulator, which we implant in the chest or in the abdomen.
Ah, okay. So, and this trajectory actually started already quite some time ago, 2019. Can you elaborate a bit more on how it came about?
Yes, indeed. Well, actually, we had a grant awarded at the KU Leuven from EIT Health, which is a European platform. But the grant asked us to provide some money to education. And that's why we partnered up with Health House to make this tour for our patients.
And what do you see as an impact? And maybe let me tell you something, that for the Health House team, this is one of our, what we call, warmest storylines. And why is that? Because you have patients coming in and, I see from my layman eyes that they really are impacted by the content. But what is it for you, with your expert eyes, to see that? How do you see that impact?
So there's actually 2 kinds of people. People who are either afraid of the surgery, who know that it's a solution, but who don't really want to go into it. And by educating them, by showing them the surgery, by showing them the advantages, but also, as said, the disadvantages, they are kind of reassured, and they do step in for the surgery. Then on the other hand, you have the people who are super excited to go for the surgery, can't wait to get their operation date. But those people, we tend to make sure that they don't overestimate the potential benefit of the brain stimulation, because there are still disadvantages, there are still risks, and that's what we need to emphasize on during the tour as well.
And what you say is very important. You say the advantages, but also the disadvantages, because you really want to give the correct image and the correct information on the surgery. And that is something I can say that it really matches also with the values of Health House. So it started off in 2019. If I'm not mistaken, the grant period is over. So in layman terms, the money is gone.
Yes.
But how are we going to make sure that the project, because it's so societally relevant, can still continue?
Yes, indeed. So it's a super relevant project. Patients are extremely happy that they've taken the tour, especially also the spouses, because it's important through Health House that we educate the family, because deep brain stimulation is not a choice from the patient alone. So indeed, we are continuing. And so we reached out to the 3 different manufacturers of DBS devices, which is Medtronic, Abbott, and Boston Scientific. And we asked them to support the project, which they did. And because for us, it was really important to involve either all 3 or none. Because for it, it's super important to be neutral. So it's not an advertising campaign for DBS, but it's definitely not an advertising campaign for any 3 of them.
Yeah, and so we started off with tours in English and in Dutch.
Yeah.
Now also switching to French, thanks to your colleague as well, and then even going into German. What do you see for the future? I know it started locally, but I think all the project partners want to spread out into Europe. How do you see that happening?
Yes, indeed. We're super proud that we are currently indeed having English, French and Dutch as tours regularly. And we're indeed going on to German. But what our next step will be is to take the project virtually, because for now we have been reaching people from Belgium. But this message is super important. People from all over the world should be aware about the possibility of deep brain stimulation and should have access to objective information so they can choose to have or not to have the surgery. And that's why we are looking forward in the coming few months to start our virtual tours where we will be able to host anyone.
Yeah, sounds really great. I would like to go back a bit in time to the beginning of the project and actually the creation of the storyline, because for me it's very important that the audience knows that at Health House we always work with experts that guide us to say like, this is the content that you really need. But here it's a very special case because you have experts that want to tell about the surgery, that need to tell specific information about the surgery. But on the other hand, it's a trajectory for patients. So they also have their own questions. How did we manage that?
Yes. So from the very first start, we went out to the patient and we asked the patients, what do you want to know? What are questions that you have? And because patients' questions and physicians' questions are not always the same. And that's how we really wanted to make it personal. And throughout the years, we have had multiple questions, multiple rounds of innovations, as you know. So I think we're about the third version of our content currently. So really want to try and keep up to date, but with a very strong scientific background. So anything we showcase here has some scientific literature stating what we are actually showcasing here.
And maybe as a last question, we use a lot of digital content, animations, we use movies and so on. Do you think that's a good way to bring over a message of such a complex thing as a deep brain stimulation surgery? And could other types of surgery also benefit from that?
Oh yes, definitely. So one of the added values here at Health House is that we have the possibility to do so much. So we are showcasing the material itself, a lot of info charts, but also a testimonial. And that way the people feel very involved into the topic. So deep brain stimulation or DBS Select here at Health House is just one example. I'm sure that this can be one of the first examples of many, many more to follow.